It's terrible. I go nuts because we as specialists do nearly everything to chronify our pain patients. You don't believe me? Stick with me in this video and you'll know what I mean. This isn't true for everybody, but sadly enough, for majority of people working in the medical system and treating pain patients, chronic pain patients. So I hope you gain some insights here and I can tell you something that you haven't heard like this before. First of all, it's very dramatic that we as specialists do often treat pain patients with chronic pain like they had acute pain. And there's a huge difference between acute and chronic pain. While acute pain comes from bodily reactions to things like threat, illness, and injury, the chronic pain is something totally else and is more based on a sensitization of our nervous system, on learning mechanisms, and so on. So we do have the same experience in our body, but they have different sources where they come from. And so they have to be treated differently. And we just don't do that. You got pain? Okay, take a pill, take an injection, take an infusion, or maybe even a surgery. And does it work? Well, yes, it does. Short term. Okay, it's nothing that's supposed to work on long term. And the pain returns again and again and again. And that's chronic pain. And of course, we can use all those things with chronic pain. There's no doubt about it. It's just the amount of it that's different to the acute pain. Just take as much as is really necessary. Else you will pretty fast go into some state that's not really good, where you numb out and where you can't live your life anymore. Because else we get into something like the opioid crisis in the US. And I think that's something nobody really wants. Sometimes surgery is necessary and it should be done then. But the amount of surgery, especially that's done on the back, is way too high for what it should be. And by this, chronification sets forth and forth and forth. And the question is, does it help with chronic pain what we do there? And the answer is most certainly no. Just check your own experience. Check what you've been going through and what you did. Did the pain go away? Did it get better? Did you have these times when the pain got more and the frustration came up and maybe the depression or the anxiety and all the tension inside came up more and more? That's pretty normal because the pain comes and comes and comes, and all we do just helps us in the short run and not in the long run. So we need something that's more like a long-term goal when we treat chronic pain. The truth is, the more invasive we treat pain, the more likely it will chronify. The more often you do surgery on the back at the same spot, the more often you do surgery on the knee and the shoulder or somewhere else in the body, the more likely the pain will stick with you. Of course, sometimes surgery has to be done, no doubt about it, but often enough, especially on the back, it's done way too often. And all the guidelines show us already that in a lot of cases of back pain, we don't have to cut, we have to train. What is your experience? Let me know in the comments down below. Did you ever have a physiotherapist that scolded you for showing avoidant or protective behavior? Like leaning to the right, not putting too much weight on your leg. It's something I do very often, and often enough subconsciously. And my physiotherapists, they always went like, oh, giddy up, go back. And what I tried to avoid was pain. I always wanted to go out of the pain. And that's why I shifted my weight. And this is what we call avoidant or protective behavior. Often enough, we as patients do it ourselves, but sometimes this gets reinforced in the treatment. And this is all the passive treatment that we often get. What is passive treatment? Passive treatment is something like massages or passive physiotherapy. I mean, it's something we all like, don't we? I mean, I do. I really like to be massaged, like, oh, it feels so good. But it's also only a short-term treatment. And we know that it doesn't help in the long run, just like the passive treatment. Of course, in some cases, you have to mix it a bit, okay? You have to loosen the muscles a little bit so you can do the training, you can do the exercises. And for this, it might be necessary to do a little massage. But it's all in the service of getting active again. So activity is something very, very important. And if you look at a lot of physiotherapy, it's not what they do. They stay passive. And this is something that leads to more chronification over time. Well, to treat chronic pain like acute pain is, to put it nicely, pretty shitty. It fosters your chronification. What you need is a specialized treatment, and there are such places where you can get it. It's a specialized pain treatment that's mostly done in pain centers and hospitals, but sometimes the doctors that are throughout the country can do this too. I put you a link down there from the IASP, the International Association for the Study of Pain, where you can find such centers in your country. In these centers, you often find medical doctors, physiotherapists, psychotherapists, and sometimes even OTs. And they work hand in hand, and that's the best treatment you can get. All around this concept, I will do another video that comes out next week on multimodal or interdisciplinary pain treatment. So what do you think about it? Leave me a comment down below and hit the subscribe button if you like the video so you don't miss any of the new ones that come out. See you taking our step into life.